So I've been interested in science and medicine virtually my whole life, and after undergrad with a focus on biology, and actually I was part of an 8-year med program, but instead of going to med school, I actually ended up starting up a drug R&D company with a couple professors, and then from there that didn't work out, but it led to a 20-year career in investment banking, where half of that time I spent covering these large pharmaceutical companies at places like JP Morgan and Leerink. And then I got tapped on the shoulder by Fidelity and to join them in Boston to not only manage this pharmaceutical fund, but also to be their global pharma analyst. And so I've always been interested in innovation and medicines. Yeah, no, I think the market has caught up with the view that we are on the cusp of the biological century. I know it's something that Doug has talked about, and as Nubar has commented, that not only are companies and scientists are now given this permission to leap with these new tools that we have, and whether for, tools, imaging, machine learning, all these new tools that are going to enable us to deliver on new modalities and new products in ways that have never been done before, with Moderna and frankly some of the other COVID manufacturers demonstrating over the last year. And then when you couple that with, frankly, I mean, globally, we're in a tough situation from a growth perspective. Some experts have said this next decade could be a decade of lost growth. Well, where are you going to find growth? And two of the most innovative sectors out there are tech and biotech. And so I think we're benefiting from those tailwinds today and for the foreseeable future. Yeah, my wife, she's an endocrinologist at the Brigham, and her research passion is, which originated from some experiences she had helping volunteering in Uganda and Tanzania, working in these medical clinics. She was just shocked to see the number of people coming in with diabetes-related complications, whether it's blindness due to, or infections, pain, amputations, lost limbs, etc. That she was just shocked by it, and so she, as a result, has devoted a lot of her research towards how can we optimize and deliver better care for diabetics in the emerging. In some of these refugee camps and humanitarian settings, and of which it's a shocking number. There are about 80 million refugees today, and it's growing. And frankly, all the tools are available to help these people. It's just a matter of how do we marshal all these different organizations and provide some guidance and framework to help them. And actually, my father, who was also a doctor, although an OBGYN, he suffered from type 2 diabetes for decades, and then unfortunately several years ago passed away from some complications related to it. So I'm fortunate to be married to an endocrinologist, and that, I mean, it's a reason why I'm really passionate about helping this effort of bringing better diabetes care to those in humanitarian settings.